High Fidelity Wraparound es un proceso de planificación intensivo, orientado a la acción en equipo dirigido por la familia. Está pensado para ayudar a las familias que tienen niños y jóvenes con problemas graves y complejos de salud emocional y conductual. High Fidelity Wraparound es parte de un enfoque de sistemas de atención que involucra 3 niveles: filosófico, un conjunto central de valores, infraestructura, incluidas políticas y financiación, y finalmente, servicios y apoyos a nivel local.
So High Fidelity Wraparound is a practice model for care coordination, and it embodies all those values. So the child and the family is involved. In fact, they're the centerpiece of that care coordination and planning. And they really call the shots. They're in the driver's seat, so to speak, about who should be at that planning table, where they see things going for themselves, what strengths they have, what needs they have. High Fidelity Wraparound is where it really all comes together at the child and family level.
Without question, at a direct child and family level, we are working with families who had children who had been in residential care for years, or who had multiple hospitalizations, or were going back and forth between juvenile justice, mental health, and child welfare. And by serving them together collectively in a wraparound fashion, we clearly have less children in residential care. We have children with complex needs living in the community and really connected to doing things that all children should be doing, going to after-school programs, staying in their local school district, and living with their families.
I think that High Fidelity WRAP is a vehicle to achieve much of the outcomes that healthcare desires. And that is improving the overall health and wellness of individuals and families. That improves their lives. It improves the potential to achieve educational outcomes, employment outcomes, and lower healthcare costs, all of which yield better outcomes for our entire community or society.
The opportunity to be able to do high fidelity WRAP through systems of care was really especially good because it gave counties the opportunity to say, it's not that much more expensive. It actually saves money in other ways. So if you give the kid and the family what they need when they need it, you're not going to be paying for residential, child welfare, juvenile justice, all these other systems that will ultimately be engaged because we weren't able to wrap the services around the child that were intensive and necessary at the time.
Las reuniones mensuales del equipo para niños y familias son facilitadas por un gestor de cuidados. La asistencia incluye a la familia, sus apoyos y proveedores, incluidos los jóvenes y a los asesores en situación similar de la familia.
There's something about what we focus on we get more of, right? And I think there's something about this wraparound. We do these meetings every 28 days. And so all the roles are always focusing on looking for strengths, looking for successes. So it's a different angle and a different lens to look at these families with than what they do wrong. What's the problem of the week this week? So it's a different lens, a different focus. I think that helps. But yeah, so we have youth peer advocate, we have a family peer advocate, and often the action steps will just include everyone from the team has some part in the plan of care. So they have some ownership as well, right? So they know what they're focusing on individually with each youth.
High Fidelity Wraparound is evidence-based, and it approaches evidence-based practice by saying, here's a set of principles, right? A set of principles in terms of how one should deliver care coordination, right? That care coordination should be family-driven, it should be youth-guided, the services should be tightly coordinated, everybody should be honoring the culture and the linguistics of the family, right? We should be striving to address this child's needs in the least restrictive setting, et cetera. So there's that framework, right? But the rest of it isn't prescribed by the practitioner or the care coordinator or anybody but the family and the child. So that's really where the uniqueness of High Fidelity Wraparound comes in. It's got a consistent set of principles, but the way it looks with each particular family and child is going to be unique.
I think the wraparound model was the only thing that was really going to work for this family. He'd been in care for 8 years and in and out of care in psychiatric hospitals. And there was just something that finally, I remember this one CFT meeting, we finally just felt like everyone's energy was so focused on what was working and what else needed to be done. It was almost like we all said at the same time, he needs some repetitive, self-talk that he just hasn't had before. Like, it's like a really simple answer, and it was so amazing. So, but when everyone embraced that on the team, and he had a little laminated card for what he was, like his own self-talk, and he had stuff in his room, and all the staff knew what it was. And so once we were able to help him align with really where he wanted to go, it all came together for him.
High Fidelity Wraparound es claramente beneficioso para las familias y les brinda muchas de las herramientas que necesitan. Se han recopilado datos para informarnos sobre el impacto y los beneficios de High Fidelity Wraparound en colaboración con el Centro de Investigación de Servicios Humanos de Sunny Albany.
Caregivers report that their children who participate in wraparound experience fewer symptoms on a number of different factors in areas such as internalizing symptoms, so this would be symptoms of anxiety and depression, as well as externalizing, so these are things like acting out or hyperactive behavior, and as well as in the areas of attention, so ability to concentrate and stay focused. Caregivers are reporting that their children are experiencing less of these types of negative symptoms during their participation in wraparound.
We're seeing that the CANS acuity scores, which represent the youth and caregivers' level of need, are going down during the course of wraparound. So the need scores are about 98% high acuity when they start services. And then over the course of wraparound, we're seeing a reduction to about 72% high acuity. So the overall high acuity score is going down over the course of wraparound. It's also interesting, we're seeing some significant changes in some of the specific areas of the CANS as well. So the caregiver needs scores are reducing significantly over the course of wraparound, and also the child's level of need in the area of behavioral health, as well as trauma symptoms, are also showing significant reduction over the course of wraparound. One of the really interesting things about child strengths is that we are seeing some improvements in these strength areas of persistence, optimism, adaptability, resourcefulness, and resilience. And this is really important because these are skills that the youth can take with them once they've left the formal wraparound services.
Another very interesting thing that we're seeing with families that have gone through high fidelity wraparound is that the Medicaid spending on residential services is reduced. So what does that mean? That means that the services and supports that we're delivering through high fidelity wraparound are reducing the likelihood that children will need residential services. That's really great because we know that being in a residential setting for children sometimes is necessary, but it's usually not the best thing for a kid's well-being. So there's some promising results that we're seeing already.
And if you look across all of these different domains that we measure on mental health recovery, there seems to be improvement for both youth and caregivers. So while improvement on any one of these different areas of mental health recovery would be important and suggest that wraparound has a positive impact on young people's lives as well as caregivers' lives, if you take it all together, it suggests that it drives improvement holistically and not just reduces symptoms, but helps young people and families have a more positive outlook on their trajectory after wraparound.
Well, I think as parents and families, I think that, and I'm a parent also, and we just always want what's best for our children, always. And I think that we have to give hope that we, the systems of care, can help support children and families whenever necessary. And I think that hope has to stay there. And I hope that my hope is that we exuberate confidence in localities and children and families to say, but we can and we will prevail.
If you look at a family with very high needs, very complex needs, that's consuming a lot of Medicaid services, And then after this intervention, during and after, I should say, during the High Fidelity Wraparound, and then even after they've been discharged, that spending continues to decrease. It's really good news.
Esperamos que haya logrado comprender y apreciar el impacto y los muchos beneficios de Wraparound. Hemos aprendido que para las familias con niños que lidian con problemas graves de salud emocional y conductual, High Fidelity Wraparound puede proporcionar una solución poderosa y rentable. Puede reemplazar la angustia y el miedo con oportunidades para que las familias y los jóvenes logren su visión de una vida mejor, ofreciéndoles verdadera esperanza y optimismo para el futuro.